Hygiene covers if they're not already covered. Hi, my name is Ingrid. I'm gonna be your nurse today.
Hello.
We're gonna go ahead and do a physical assessment from head to toe. Basically, we're gonna check if everything's okay. Okay.
Okay.
All right. So before I do that, I'm gonna go ahead and put the back up. Alright, so can you tell me your first and last name?
Twina Wynn.
Tween Wynn. I'm double check on the wristband. What is your date of birth?
October 25th, 1992.
Okay. Everything seems fine. It's on the chart and on the wristband. And then do you know where you're at right now?
Yes, I'm at the hospital.
Okay. Do you know what year it is?
It is 2021.
And who is our president?
Joe Biden.
So my patient is orientated times 4. She's alert. She's aware of her surroundings. And when I step into the room, the first thing I would see would be her physical appearance. So her physical appearance already tells me like what's going on. If she has any IVs on her. She has a trach, no trach. She's clean or she's dirty. She's pretty much fine. And then after I get on her identification, I know that she's orientated. I'm gonna go ahead and start the physical assessment. I'm gonna go ahead and touch your head, okay?
Okay.
I'm gonna feel around the head. I'm gonna check for any bumps, and then also I'm looking for appearance, for any skin pigmentation, discoloration, any cuts, bruises, and then I don't see anything, which is fine. I would also check her neck to see her lymph nodes, and then I'm gonna go ahead and check your eyes. I'm gonna go ahead and shine a light on your eyes, okay? I'm gonna have you look straight forward for me. All right, so it's gonna be a little bright. And then 2, and then the next one. And perfect. So her lights are reactive to light. She has perla. So her pupils dilate to about a 5, and then right now they're about a 7, which is good. And then I'm gonna go ahead and check her ears. So I'm gonna have you look to the left for me. Thank you. I'm gonna check if any blockage, drainage, or bleeding. I'm gonna come forward for me. Thank you. Same thing.
Yes, please. Okay.
Alright, I'm gonna have you put your mask on for me.
Yes.
I'm gonna check your nose. She has no deviated septum, any blockage to the nose that's obstruction to her breathing. I'm gonna go ahead and can you open your mouth for me? Cool, and the cigarette tongue. And you can put it up for me. Cool. Alright, so mucous membranes are pink and moist. And then at the same time I would be looking at her face as well, just for her appearance to see how it is. And then from the head, the neck, I'm gonna go ahead and go to her arm. Feel for her arms quickly, gently. Temperature warm. No experience of hypothermia or hyper. Have refills less than 3 seconds. Perfect. She's well hydrated. Skin trigger on the forearm on both sides. And then if she was an elderly patient, I will go ahead and check for the chest area. I'm gonna go ahead and check for her radial pulse. Sorry, I'm gonna put your arm this way, okay? I'm gonna check. Okay, so pulse is nice and boundy. Down, and then I'm gonna go ahead and have your arms forward for me. Can you come up? Perfect. And can you put them down? Alright. Can you squeeze for me? And then push and pull towards you. Perfect. So mobility on the arms is symmetrical on both sides. There's no weakness on one side and no paralysis or anything like that. After the arm, I'm gonna go ahead and check her heart and lung sounds. So what I'm gonna do is I'm gonna go ahead and check her heart sounds first. So I would go from aortic to pulmonic to tricuspid. And maximum to mitral. Okay. Her sounds are good. There's no signs of heart murmur or any abnormalities of the heart. I'm gonna go ahead and hear her lung sounds. I'm gonna have you breathe for me, okay? Breathe. Breathe. Breathe.
So only these ones?
Let me check this closet to see if there was older ones or.
Perfect. So her lung sounds are fine. There's no sign of productive cough. There's no wheezing. There's no crackles in her lung sounds. And then after that, I'm gonna go ahead and go down to her stomach. I'm gonna look at her stomach, look if it's distended. If I would obviously look under her clothes, but since we're at the skills lab, I'm not gonna ask her to remove her shirt. But I will look for the skin to see if there's any indentation, any asymmetrical of the stomach, if it's round, if it's tender, as for the touch, if it's soft, temperature is nice and warm. So I'm gonna put this a little down, okay? But I'm gonna go ahead and check for bowel movements.
Looking for like an overall concept of something. Yeah. Yeah. You don't need the little test questions to know what to do.
No. I actually found that used for $10.
Did you really?
Yeah.
Okay. Just that one then, right?
Yes.
So, there's
Oh, that's the one I
bowel
found.
movement. If I didn't hear bowel movement within 5 seconds, and within 3 to 5 seconds, then I would go ahead and check every quadrant for 5 minutes, just 20 minutes in total. And then with the apical, if there was something abnormal with the heart, then I would check her apical heart sounds for a minute. And then I'm gonna go ahead and palpate. So does that hurt right there? Okay, does that hurt right there? No. So there's no pain on the abdomen. And then if it was necessary, I would go ahead and check her private parts. But I would also look if she had a Foley catheter on the side of the bed. And if she had a Foley catheter, I would check the color and then the amount of drainage. And then I believe that's it. The output and the color. And then the measurement. And then if it was a male, I would check the foreskins of the male. If you didn't have anything in the foreskins, if I needed to, and then just like check all of them there. And then I'm gonna ask, when was the last time you urinated?
This morning.
Do you know what color, any pain, discomfort?
There's a little blood.
Little blood? Okay. So that's not normal for you, right?
No.
Did it hurt?
Kind of.
Kind of painful? Okay. And then what about, when was your last bowel movement?
Yesterday.
Yesterday? And how was that? Was it normal as well or just abnormal?
It was normal.
Normal? Okay.
I think if you, every day that you.
Alright, and then I'm gonna go ahead and lower the blinds. Is that okay? I'm gonna go ahead and check your legs.
And if there's no request, I can remove it.
So I would look at the appearance of the legs, check for any swelling, and then I know for indentation, if there's like swelling, you check for the finger. But I see no signs of swelling, and then I would touch for the temperature. Temperature should be the same as on the chart normal. And I would check her pedal pulse, which is, I could do the anterior tibialis, or I could go on the front, typically, this would be without her socks off. And then I would have for mobility. Can you put your right leg up? Alright, can you put it down for me? And then left leg up. And put it down for me. Okay, I'm gonna touch your feet. Okay, can you pull towards you? And then pull downwards. Perfect. Mobility is same and symmetrical on both sides. And then so that is my assessment for the anterior. So I would go ahead and check the back side. So is it okay? Are you able to move?
Yes.
Move around? Okay, so I'll have you turn.
Sorry, I was helping a student.
So I'm gonna go ahead and check her back side, look for appearance always, and then check if she has any pressure ulcers on her buttocks, any redness of the skin, checking her heel as well, any ulcers here too. Everything's fine. I'm gonna have you turn forward to me.
There was like, there was a half
Perfect. And then I'm gonna go ahead and put the bed to a semi-Fowler. Alright, are you able to sit forward for me?
Yes.
So far, I'm gonna go ahead and mosquito tape the one time on the back of on the back side. Okay, I'm gonna have you breathe for me, okay? Breathe in. Breathe in. One more time. Perfect. I'm gonna have you sit back down. And then I'm gonna have you turn your neck to the left piece. Okay, and then to the right for me. Cool, so there's no JVD present. We'll put the blinds up. Make sure my patient is comfortable. Are you comfortable? Do you need anything?
No.
No? Okay. I'm gonna go ahead and make sure I have the call right next to her. Call if you need anything, okay? I'm
Okay.
gonna go ahead and step out momentarily. And then if she had like a food tray, I would put it near her bedside. And then I would do hand hygiene. Obviously I'm wearing gloves this whole time. Hand hygiene, and then step out of the room. And then I would document my findings. So the findings that I found was she did tell me that she had discomfort and bleeding in her urine, so that I would make sure to document that. But everything else she was fine. And that concludes my physical assessment.